to the Consults tab. And just to note, and I don't remember if it was brought up earlier in the class, we are a combined facility, so we take care of both veterans and DOD. So when patients are first admitted here, they need to be what's called jointly registered. And that way, when any lab, radiology, imaging, or consult order is placed, it actually goes across into both systems. So if an order is placed in Alta or CHCS, it flows into CPRS. And if one is placed in CPRS, it flows over into Alta CHCS. Just keep in mind, medications do not. Okay. So this is the Consults tab, and we're looking at all consults here, and they are in reverse chronological order. Okay. The date that you see is not the date that the consult that was completed, it's the date it was actually ordered. Okay. So this particular consult was ordered on January 24th. It's an electronic consult to gynecology. Electronic consults here are what we call curbside consults, or like a physician to physician, where the patient might not need to be seen. It's just asking for some advice or their opinion, and then they can complete it, give their opinion, and the patient doesn't need another appointment. If it's decided that a patient does need to be seen with these type of consults, it should be forwarded to a regular consult and not an electronic consult. Okay. So this little icon here, it looks like a folder or a notepad, is what's called a consult. The little caduceus here are procedures. They act differently. Procedures are looking for information that's being sent over from an instrument, whereas a consult, a provider input. Okay. In parentheses, you may see various letters for consults. When a consult is first ordered, it's in a pending status, and so you'll see a P in that. All consults need to be what's called received in within 2 business days. You would click on action, tracking, and then you would receive it in, is what it is. Generally, that's done by some MAS staff, or it could be providers in the specialty area where it's ordered to. Once it's been received in, this little letter here would change from a pending to an A for active. At that point, generally somebody is attempting to contact the patient and schedule an appointment for the patient. Once it's been scheduled in the VSC scheduling software, it automatically updates the consult to a scheduled status. And you will see in the body of the consult, which it would say scheduled here along with the date, time, and clinic of the appointment. When a consult, let's say, has been completed by a resident or fellow, this letter here would change to a PR, which is pending results. So that's just waiting for the attending to co-sign the note. Okay. An X means the consult was canceled, and there can be various reasons why a consult is canceled. If the patient doesn't meet the required scheduling, they're supposed to, what our staff here, what they do is they attempt to contact the patient to schedule an appointment. At that point, they then send a letter to the patient's residence on file. They wait for 2 weeks. If they have not responded or scheduled an appointment, our MSAs and RNs are able to cancel the consult. Consults can be revived, meaning if the patient calls 2 days later, I want to schedule an appointment, it can be resubmitted, it becomes active again, and then you would schedule the appointment. A patient may call and say, no, I don't want to be seen in, say, urology clinic for whatever reason. A clerk would then cancel it. The cancellation and discontinued consults send an alert back to the ordering provider to let them know the patient in that situation did not want to be seen, so that they're aware of it. Now, the ordering provider can then call and contact the patient, you really need to be seen. They can then resubmit the consults. But after 90 days of being in that canceled status, it automatically updates to a discontinued status, which means it's dead. It cannot be reactivated. Okay. So for completed consults, like you see right here, well, this is a procedure. Over to the right at the top, you see the actual order for the consult or what's been entered in. And then down below is the progress note of what the clinician's advice or suggestions are. Now, for a clinical procedure, this is the instrument data that came across on what this echocardiogram showed. So if you look at, I'm trying to find a different consult here besides just a procedure. Here's a completed like a DOM addiction. So this order was put in by Dr. Coe. The reason for this particular request was alcohol abuse and the requesting services. So the provider that received the consult and completed it showed that, well, it looks like it was a test, but normally they would say recommendations or what have you. The consult was received, and then they complete the consult as appropriate. Okay. Discontinued, like I mentioned, means the consult is dead. It can no longer be submitted or ordered. All consults should be completed within 30 days. That's the goal here, although sometimes patients need to be seen a little bit later and it will go over that 30 days.